I'm Dr. Chad Lavender. My fertilized ACL technique has gained national and international attention. It all started here on a small football field in West Virginia. That's where my passion to help athletes and others began. My passion comes from my time as an athlete from early on here in West Virginia. The issue I saw is patients and athletes that I played with basically had a hard time recovering from ACL surgery. Some of my friends would take up to a year or more, or maybe they never played again. And so I always continued to say, how can we make this better? Are there new technologies that offer a benefit to patients? We continued to change our procedure really for about a year as new technologies came out. And that's probably the core of what we're doing, is really to try to push the envelope and to try to improve on the procedure, the ACL reconstruction.
My name is Julian Q, and I'm from California, Inland Empire. I was playing football, and I was doing a corner route, and I planted too far, and my whole knee just pretty much twisted out.
I'm Jax Brown. I'm a quarterback at Weiss High School. When I tore my ACL, I was playing in our 6th game of the season. Somebody hit me up high, and it kind of just twisted my knee in weird, and I heard a pop, and I was like, oh, that doesn't feel good.
So my name is Zach Justice, and tore my ACL, meniscus, playing basketball. Hit a Euro step that wasn't fun on the way down.
I was playing basketball at Under Armour Nationals in July. I went up for a layup. I didn't even get off the ground. I heard a pop, felt a pop, and I knew something was wrong after that.
Everywhere I looked, it was such a grueling process. People were saying, you'll never be back to normal. You'll never be even close to what you were. The surgery is pretty cut and dry. This is the only way to do it. And I always know there's someone out there in the world that's really innovating. And so I did my research, and I found a man by the name of, Dr. Lavender, and he had this cutting edge surgery that was getting people back in considerably faster time with much better results.
We were going through trying to find the best doctor. We were looking online, and we saw Dr. Lavender. We saw a couple of videos of him. We were like, wow, he's probably one of the best doctors we've seen.
And in this case, because it was my son's knee and it was such a big surgery, we wanted to make sure we're doing the right thing. My husband did a lot of research. He found Dr. Lavender. He did all the research and read all the medical documents that were online. And he really liked Dr. Lavender, and I thought, this is crazy. This is really far.
I think everyone always goes in with a little bit of skepticism. Was this true? I mean, the results were there, but I'm not sure.
Of course, I was skeptical at first. I was like, there's no way. I mean, I'm not gonna be healthy in 6 months. This is a known injury that takes a long time.
One of my teammates actually had just had surgery with Dr. Lavender. I knew that, how she recovered was different from other people. We knew right then and there that's the kind of road we wanted to go down, and we didn't look back.
After seeing the other doctors and what they could offer compared to what Dr. Lavender could offer, we both agreed, me and my husband agreed, and my son, that we're gonna go to West Virginia to have this surgery.
We were seeing all these people, they're 8 weeks, they're already jogging and cutting a little bit. That was a kind of a turning point where I was like, okay, this actually looks legit and we need to do this.
I personally have had 19 different states and locations that patients have traveled from for this ACL reconstruction. They're coming to an area in West Virginia, a rural area. This is not New York City, it's not LA, it's not Miami. That takes a lot of really motivation and preparation to come all the way here. but they believe in our technique, they believe in the process, they believe in the science behind it, and that's been something remarkable to see for me.
Just a few months ago when we really started to see the results come from it, and then we've started to get all of these out-of-state athletes, and it's just blown up, I think, over the last 6 months or so.
I knew nothing about West Virginia. I'll be honest, it was new territory. It's different from California, but honestly, after like the first week, I really like West Virginia. I fell in love with it. The people are great. The service at the hospital was amazing. Everybody's just great and so nice with us.
I figured the best medicine would be here, but any doctor I met with, I felt like I was just a number. I wasn't a human being. And then when I talked to Dr. Lavender, it felt like he really cared about his procedure and how it was going to affect me. And even if it was a regular surgery, not his new technique, I probably would have went with him just because of the care I was receiving. So it was amazing.
He loves his athletes, he loves his patients, he wants to treat everyone like family. He is a perfectionist. He just wants everyone, to do as best as they can.
We did a trial here where we randomized patients to a standard ACL reconstruction versus the fertilized ACL. And we found exactly what our hypothesis was, that the fertilized ACL patients did much better, especially earlier on.
We documented my whole recovery process on Twitter. And I think around the 4-month mark, I was like, okay, I got this. And I got tested first at 5.5 months and passed the test. And then 6 months, I was released. I think I got released the 23rd and I played that Friday.
After, I'd say 3 or 4 weeks, I was going up and down, like walking up and down steps, doing everything I wanted to do. I got back and I was like walking there just like, didn't you just like have surgery? Like, shouldn't you be like on crutches and stuff? And I was like, nope, I've been walking for a while now, like I'm good.
I wasn't supposed to, but don't tell him this. I was walking on day 1, and within the first week or 2, I went in front of him and I did lunges. Yeah, I was able to do that. I was able to walk upstairs. I was able to feel very stabilized. I was doing squats. It was everything that I could have wanted and more when I'd done the research.
We did testing at 12 weeks on how they were actually functioning, doing hop testing, and the fertilized ACL patients were at 80% of the normal extremity versus the standard group, which was about 35%.
I remember an MLB player texted me and just asked me, how are you able to do this? And I was like, you gotta get this surgery from Dr. Lavender, and it was just a cool experience.
We had some guys tear their ACL like in previous years, and they were out for like a year, and they were like honestly shocked that I was even like doing any of the things that I was doing. I was off crutches in like a week and a half, and they weren't lifting for like 6 months, and I was back in there in 3. So they were just shocked.
It's very gratifying when you see the results of the clinical trial and everything that's happened and really the momentum that's been created here at Marshall. But it's always about the patient in front of you. Everything we do is always about that patient that's in our clinical room that day or our OR. It's about that athlete and getting that athlete back on the field to their potential and having them have a successful result. That's what it's all about.
I started out as a nurse in the OR and didn't ever get to see the final outcome. And now I get to see that. I get to see these patients come back at 3 months and 6 months and watch them progress, and it's just amazing.
I know I just seen a patient in his office this morning from California, which is amazing. So we would absolutely recommend this procedure and Dr. Lavender's team to anybody.
I have never been afraid of my knee or anything like that. I've had all confidence, and that's shout out to Lavender and Jason Huffman, my therapist, and with Marshall. So I think that I've never had a doubt in my mind, and that's helped me back on the floor.
You did great on my knee, and I'm thankful for it.
And I tell people all the time, I would like to move to West Virginia, but no, seriously, it's been such a good process, and we always talk highly about Dr. Lavender and West Virginia and Huntington and the people here.
You're going to be treated as a person, and you're also going to be treated with the best medicine you can in this field. And I think that just speaks volumes, and just the care he has again as a person. I would have taken double the recovery time just to hang out with him.
It's just amazing. I mean, there's nothing negative I can say about it. So, I mean, if I was talking to my pre-injury self, I'd be like, man, this is the best thing for you. I mean, I don't think you can get this anywhere else.
I knew when I wanted to pursue medicine and orthopedics that I wanted to do something special and bring that right back here to this state. And we've done that with the fertilized ACL. The fact that patients from around this country choose to travel here for their care and surgery is really remarkable. It's something that this area, this state, and especially Marshall University, Marshall Health should be very, very proud of.